A lot of great people who are going to speak with us today and share a ton of information. And so I want to go ahead and get started. As the chair of this committee, however, I have to read an opening statement. This is completely standard, but I am so glad you all are here. This task is being undertaken by this committee for the National Academies, is to comprehensively evaluate and develop evidence-based clinical diagnostic criteria for ME/CFS, which is indicated on the information sheet that has been handed out. Oh, and by the way, welcome to all of you who are watching this. We're really glad to make this opportunity available to you so that you can see what's going on and send us comments. And I would also like to give some sense of the format of today's meeting. We will begin this afternoon session with a panel of patients and advocates who will be presenting on the challenges faced by ME/CFS patients in their interactions with the healthcare system. Following the presentation of these panelists, the committee members will have 30 minutes to ask questions. After this Q&A session, we will have Dr. Jason presenting on the diagnostic criteria for ME/CFS. And then Dr. Kishi will talk about sleep disturbances in ME/CFS. And finally, Dr. Lang will present by teleconference on neurocognitive manifestations of ME/CFS. After each of these three specific presentations, the committee will have 10 minutes to ask questions. I want to note that this is an open, on-the-record session. Interested individuals and members of the press have been invited to attend as observers. This is not a news conference, and we will not be entertaining questions from the floor. Reporters who would like to talk with members of the committee are kindly asked to touch base with the staff at the National Academies Office of News and Public Affairs, Molly Galvin, and should plan to do so during the break. And this next is really important. I would also like to remind everyone that this is an information gathering session. That is, the committee is in the process of assembling materials that it will examine and discuss in order to make its findings, conclusions, and recommendations. Therefore, I ask everyone here today to be extremely mindful of the fact that the committee has made no conclusions and that it would be a mistake for anyone to leave here thinking otherwise. Comments made by individuals, including members of the committee, should not be interpreted as positions of the committee or the National Academies. I would say that you can be assured that that the presenters today will get some pointed questions to try to clarify issues on which the committee is trying to understand. These are just to help our understanding. That's the goal here. And these questions may not be indicative of our personal views or what our ultimate conclusions will be. The committee will deliberate thoroughly before writing its draft report. Moreover, once the report is written, it goes through a rigorous review process by experts who are anonymous to the committee, and the committee then must respond to this review with appropriate revisions that adequately satisfy the Academy's Report Review Committee. Having said all of that, so that you don't take away that we've already decided something that we haven't, it makes it all the more important to emphasize that you all are here because we are very eager to hear what you want to say. So I'm going to ask each person to present in the order in which they're on the agenda that I have. You will each have 15 minutes to speak. And then there will be question and answer from the committee. And the first person is Joseph Lanson.